Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. And so let me introduce you to this week's guest, Daria Lipscomb, who is the Communications Director for the Metro Atlanta American Heart Association, is with us today, and Kimberly Goodlow, a survivor of several heart surgeries who works with a company called Mended Hearts. Daria, Kimberly, welcome to the show. Thanks for being here with us today.
Thank you.
I think we'll start with you, Daria. Let's talk about the Metro Atlanta American Heart Association, because I know that right now we're in National Heart Month.
Yes, and we are so happy to have the opportunity to really get Atlanta and the nation really to focus on their heart health and cardiovascular health. And so that's what February is all about. It's about trying to make sure that people are doing the small things that they need to do to make sure that they're taking care of their hearts.
And how did you get involved with the American Heart Association in Metro Atlanta?
I started with the Heart Association about probably 3.5 years ago, and have been in the nonprofit sector for a while, but was very drawn to the mere statistic that it's the national number one killer of Americans. So I have worked very diligently with the Heart Association to try to spread awareness and education throughout Metro Atlanta.
That was my next question. What is the role of the communications director? So you spread awareness and education throughout Metro Atlanta about heart health.
Yes.
And we are in the Atlanta area. This radio show reaches out to folks in Atlanta, but we also have a show in Phoenix, Arizona. So we're airing out in Phoenix as well.
That's great.
So although we're talking with you today from the Metro Atlanta American Heart Association office, what you have to say and the information that we will be providing on today's show is pertinent to people all over the country.
Absolutely.
So all they have to do is get in touch with their local American Heart Association.
Absolutely.
chapter.
We have offices all over the nation.
Okay, great. So I'm reading here, what is Go Red for Women, and why should we care about that?
Well, Go Red for Women is our national campaign that's focused on trying to make sure that women know that 1 in 3 women die of heart disease. Usually we think about heart disease as a man's disease, when actually women are dying at a very increased rate with this disease. So we're trying to focus on women actually doing the things they need to do in their daily lives.
Is it more prevalent in women, or it's a growing prevalence in women?
It's very prevalent in women, and it's growing and increasing every day. So we are trying to make sure that women are taking care of their hearts. They tend to not focus on the things that they need to focus on in their daily lives that would, cause them to basically take care of their hearts. So the physical activity, eating a nutritious diet, and making sure that they are decreasing stress in their lives. These kinds of things are the things that we're talking to women about to make sure that they know that they are at risk. And it's not just a man's disease. It can happen to you when you're young. These are the things that we're trying to make sure that women know.
And are you seeing a growing prevalence in this? Because, nowadays, I'm sorry, but we women, we have it tough. We're all working full-time almost now, and taking care of the household, and taking care of the children, and who the heck has time to exercise anymore? I'm struggling. I'm thinking I got to get up at 5 in the morning just to fit it in, so I'm back in time to wake the children up and get them on the bus.
Exactly.
And so do you think that that's one of the reasons? Because we're just leading such busy lives these days.
I think it's definitely a factor. So what we're trying to tell women is that you can fit physical activity in any time during the day. We're asking women to walk during lunchtime. We're asking women to just do 20 minutes in the morning and then do 20 minutes in the afternoon. As long as you're getting your heart pumping, you're doing something for your heart and you're decreasing your risk factor.
Even, I have a friend who's on me all the time, and they said even so much as parking in the furthest parking spot when you're going to lunch.
Exactly.
And just walking that little bit further of a distance can make a difference.
Yeah, we're in companies every day trying to make sure they have the environment in which women and men can fit in the physical activity and the diet that they need during the day, because we know we spend most of our time at work kind of sitting at a desk. So instead of sending an email to your colleague, why not get up and walk to their office or go up a floor,
figure.
up
Who
the
does
staircase
that anymore?
Don't use the elevator, that kind of thing. So you can get your physical activity in moments and spurts throughout the day.
Yeah, see, and I think the pressure to do so much in such a short amount of time, even in the work world, is hurting all our health. And that's got to lower productivity as a whole.
It absolutely does.
Yeah. Are there certain demographics regarding heart disease that we want to let our listeners know about? Are certain cultures more prevalent with heart disease?
Absolutely. African American and Hispanic populations are at a very increased risk for heart disease, and that is based on the fact that other risk factors are prevalent within the community. So diabetes, high blood pressure, high cholesterol, these are the things that will really affect your heart health, and they are increasing within those populations.
I know because I've done shows in the past on diabetes, and it is so prevalent in the African American community. So there is a link between diabetes and heart disease. So
Absolutely.
if you are a diabetic, you have to take even more care of your physical activity and nutritional intake to make sure that it doesn't develop into a heart disease, correct?
Absolutely. And so when we're asking people to pay attention to their heart health, we're saying to them, go to your doctor and find out whether or not you are diabetic. Make sure that you understand whether or not you have high blood pressure or you have high cholesterol, because these are the things that you need to manage to take care of your overall heart health.
Now, I'm not a nurse. You're not a nurse either.
No, not at all.
But I have to tell you, as a 40-something, more and more friends are ending up in the hospital with anxiety attacks or getting checked for high blood pressure and heart disease, and it seems like it's much harder to pinpoint in women. Is that true? It seems like they might have the symptoms, but the tests don't come back showing anything. And I've heard that before with a man who might be at risk for a heart attack. I've seen some of the commercials. It shows the cells building up and blocking. But with women, it might line the arteries in a more narrow way, so there's still flow, but that's still very dangerous for women. Am I making any sense here at all?
You are, and I am not. I'm not a medical expert, so I wouldn't be able to really speak to that in a very real way. But we are seeing that women tend to present differently than men when they're having heart attacks. So whereas you think about severe chest pain and people clutching their chest, and it's an obvious heart attack, women sometimes feel pain in their neck or jaw, and it's just a dull pain, and they can walk around with it, and it's not bothering them that much. They're kind of thinking, wondering what's going on. But really, it's something that's presenting that has to do with having an actual heart attack.
So we really have to take note of our bodies.
Correct.
Even more closely, because we're not getting those crisis signs, and we can prevent a crisis if we are really paying attention. So jaw pain, I didn't know that. Now, what about back pain?
Absolutely.
See, and it's so hard because we women will take some Motrin or take some Tylenol and say we pulled a muscle.
Exactly. So it's really about paying attention to your body, and if something is there that you did not feel before, going to the doctor and making sure that you're getting screened for heart disease or any other situation that might be happening with you.
I have so many more questions, but I don't want to talk so much that we don't have a chance to listen to the incredible story that Kimberly, you have. You are a survivor of several heart surgeries?
Yes, I am.
Why don't you tell us your story?
I was born with an abnormal heart valve. One day I developed shortness of breath at work, and I went to the doctor. Ultrasound was scheduled, and it was determined that my heart valve was not doing well at all. A catheterization was ordered, and then 10 days later, I received a new heart valve. I have a mechanical heart valve in my body. 4 days later, after the first surgery, I developed heart blockage. The doctors explained to my husband that I would need a pacemaker to help my heart function. A year later, I received my third surgery. One of the pacemaker leads broke. 12 hours later, I was rushed to the hospital. So it has been a journey. I'm glad I did not ignore the warning sign. The first warning sign was the shortness of breath. So I was proactive and contacted my physician. We were aware of the heart valve, but I was never sick for 42 years. I was 42 years old when I had my first surgery. I'm now 45. So now I'm committed to spreading heart awareness throughout the community through the Go Red for Women campaign, which has made a huge difference in my recovery as well, because I'm learning more about my body and the resources that are available for me and my family as well as for the public. And that's why I'm part of the Go Red for Women campaign, to share and to basically become an advocate, and that's what I am. And I'm proud to be a
It's
member.
amazing how our own experiences can spread good to so many more people. So I applaud you for getting active after your experience. I do want to talk to you a little bit more about your shortness of breath because, you know, we can have allergies.
Yes.
We can have a cold like I have right now.
Yes.
And have a hard time breathing. How severe was your shortness of breath?
It was not severe.
It
The
was
day
not.
prior to work, the day before, I just knew I was well. And when I was coming out of a classroom, something just did not feel right. And it was just a warning sign. I never had shortness.
Were you gasping or were
No,
you?
I was walking down the hallway in the school, and I just grabbed my chest.
Wow.
And I never felt that way ever in my life. And I knew something. I just knew something was wrong. And I'm glad they ignored it.
Yeah. So folks listening, Kimberly was 42 years old and wasn't gasping for air. It wasn't severe. She just paid attention to her body. So please, you know, I often say I'm blessed to be able to host this show and educate and inform you all of all aspects of living a happy, healthy quality of life. And this is one of those instances. If we have one person listening to the show today that maybe whose jaw hurts or has had a little shortness of breath, thinks maybe they have a cold, don't wait. Don't wait. Go to your doctor, schedule an appointment, because as Kimberly said, it wasn't 10 days later and she was getting a new heart valve.
Correct.
Very scary, very important stuff. And I thank God that you paid attention to your body and went to your doctor. I myself do not prescribe to my own medicine, and I am learning.
Okay. It's very crucial to be aware of what's going on in your body and being educated and speaking to your physician about any changes. And as far as the transition for my new lifestyle, it was very crucial to provide a support system for my husband and my children as well.
That's another thing, yes, because it's frightening.
Yes, it's frightening. It was a very hard conversation with my children. My daughter was 7 at the time, and my son was 10 years old. It was very hard. It was a very hard talk, but it was necessary because they're part of the healing process. My church, New Mercies Christian Church, and the school counselors at Margaret Windholt Elementary also played a vital part in helping us prepare our children for what was getting ready to take place. So it's very important to provide a support for my husband and my children while I was away at the hospital. And that's why I developed a support agenda, which was very helpful for my husband.
And now you're involved in a company called Mended Hearts.
Yes, ma'am.
Do you want to talk a little bit about Mended Hearts?
Yes, Mended Hearts is a support group for cardiac patients and their families. 3 years ago, I joined the group, and for 2 years, I visited the heart patients at St. Joseph Hospital. Now I'm at Gwinnett Medical Center, and it's a new program at Gwinnett Medical. The purpose of Mended Hearts is to provide the emotional support for not only the patient, but the caregiver as well when they're discharged and returning home, because it's a whole new lifestyle, whole new changes going on in the home, healthy diet, exercising. So we're walking them through that process. Basically,
Let's talk a little bit about that process. I
Okay.
want to educate folks about how we can help them because, like you said, sometimes the journey starts after they come home from the hospital.
Exactly. Okay. When I visit a patient, I'll walk into the room and I will introduce myself as a Mended Hearts visitor, and I will share information about Mended Hearts and why it's important to be part of the group. And we do invite the patients to join the group. But I also share my heart story. I walk them through what I experienced in the hospital, what my husband and my children experienced, and why it's important to be proactive and communicate with your family members. Let them know how you're feeling, and basically take it one day at a time. I told them it's a whole process, but you have to take it one day at a time. And so we walked through what I did at home. I couldn't drive for 30 days, just sharing what my whole journey. And that's why I'm just so glad that I'm part of the Mended Hearts organization, as well as the Go Red for Women.
And oftentimes it requires an overhaul of eating habits.
Correct.
And so part
Yes.
of that may be the whole family
Yes.
getting involved in healthy eating, and that's the best way they can support their loved one
Yes,
through
but-
the journey at home.
because they're part of the healing process as well. So being part of Go Red for Women, learning more about the heart resources available, I can go out into the community and share what I learned and to help someone in need.
Well, I sure am glad that you're doing well.
Thank
and
you.
You're sharing. Daria, we've talked a lot with Kimberly about Go Red for Women. Can you talk about how Go Red for Women reaches out to our communities, and maybe are there upcoming events? What do folks need to know about Go Red for Women?
Usually we launch the campaign at the beginning of February with National Wear Red Day, and that's usually the first Friday in February. Following that, in the Atlanta market, we have a Go Red Connect event that happens in Macy's. Macy's is a national sponsor along with Merck. And we are really doing an outreach activity. We're asking women to come in and tell their stories, how they've been impacted. And that is how we find our local and national spokespeople for the cause. Along with that, tons of women throughout the city and the state are doing their own Go Red for Women events. And they do that on their own and are doing it in support of the cause. We love that they basically are individualizing the movement and thinking about ways that they can reach out to their friends and neighbors and colleagues. Along with that, we do a lot of media around, your risk factors and awareness. Anchors go red, celebrities go red. You'll see it all the way through February. We're actually talking about wearing red to support the cause.
And I'm reading your documentation on your Go Red, say that 10 times fast.
Right.
Go Red for Women fact sheet. Why should you go red? Because research shows that women who go red are more likely to make healthy choices. And we've been talking about making healthy choices throughout this entire show. More than 1/3 of the women that participate in the Go Red campaign have lost weight. Well, that right there, I'm joining. Nearly 50% have increased their exercise. 6 out of 10 have changed their diets. More than 40% have checked their cholesterol levels. And 1/3 have talked with their doctors about developing heart-healthy plans.
Correct.
Great. Let's talk about shopgored.org, because that's one way that folks can participate. I know we've already had the first Friday Wear Red, and some of the events have already passed. But people can go to shopgored.org at any time and support the cause.
Absolutely. We have tons of merchandise that is around supporting the cause. The red dress is our cause symbol, and we are selling red dresses, and we're selling T-shirts with red dresses on them. All of that money goes to funding and supporting the cause. And then you can go to goredforwomen.org and find the Shop Go Red link and also all the resources that we have available to women.
I want to give that information out to you all, because you can go to goredforwomen.org, or you could call 1-888-MY-HEART to get more information.
Right.
I love this as someone who's trying to run a 5K for the first time in her life.
Great.
I'm trying to go from couch to 5K. It's slow, especially with this horrible cold. But I'm reading here, Go Red Better You, and it says explore Go Red Better You, the free 12-week online fitness and nutrition makeover that can change your life.
Absolutely. A lot of women have gone on, and it's free, it's online, 12 weeks, and we're basically walking you through the steps to make you a better you, a healthier you.
I love that. And then there's Go Red Heart Match, where if you've experienced heart disease yourself, you can go on and provide support to someone else or receive support from someone else who's gone through similar experiences like Kimberly, and can help you even have discussions with your families. If it happened to me, I would want to call you and say, tell me again. How did you talk to your 7-year-old daughter? How did you talk to your 10-year-old son? Because I can't even imagine the worry that mom's going to be going in and they're going to do an operation on her heart. Do I even tell them that? So many questions. Well, I'm so pleased to have you both on the show today, and I think this is very good information for folks out there. Again, this is Better Living, and this is brought to you by the Homestead Hope Foundation and sponsored by the Homestead Hospice and Palliative Care. And you can reach Homestead at any time to connect you to any one of our guests to get more information. And that number is 877-455-4472. Or, again, you can call and get information on goredforwomen.org by calling 1-888-MY-HEART. We'll be right back after this quick break to hear more from Kimberly Goodlow and Daria Lipscomb about heart health. Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. I'm back with Daria Lipscomb, who is the Communications Director for Metro Atlanta American Heart Association, and Kimberly Goodlow, who is a survivor of several heart surgeries. A wonderful story to share with you today, and works with a company called Mended Hearts. Daria, we're going to start with you again. You know, you always hear about heart disease as the silent killer. Let's talk about why is it the silent killer, and give some folks some statistics about why they need to listen to the show today, because we have important information for them that can make a difference.
Well, it's a silent killer because people don't necessarily think of heart disease as the number one killer of Americans. Also, we are connected with the Stroke Association, and stroke is number 4. So we are consistently telling people that while they should be paying attention to, for example, cancer and all of the other big diseases out there that can affect your life in a big way, heart disease is number 1 on that list. And there are some very measurable things that you can do to prevent heart disease from happening to you or your family members.
Yeah, I'm reading some of these statistics that you provided for me for today's show, and it does say that more women die of heart disease than all other forms of cancer.
Correct.
And we talked a little bit before, but African American and Hispanic women are less aware than Caucasian women that heart disease is their greatest health risk. 43% of African American and 44% of Hispanic women is that die of heart disease?
Yes.
Or have heart disease?
Die.
Wow. That's scary. 44% of Hispanic women die of heart disease? Wow. So why do you think it's more prevalent in African American and Hispanic women?
It's more around risk factors and the risk factors that seem to be prevalent in those populations. And so we're talking about high blood pressure, high cholesterol, obesity and overweight, not getting any physical activity in your daily lives, not eating the nutritious food that you should be eating daily. All of those risk factors build up to it being more prevalent in these populations.
And life is getting so busy. We talked about this last time too, but I'm 40-something, maybe call it a midlife crisis, I don't know. But I am at a point in my life where I must find balance, because I'm feeling like I'm running 60 miles an hour all the time. And here we are, the three of us, and Kimberly's here in the studio too, and we're all middle-aged women. And this is when this is most prevalent, right? Is there an age group that this targets more than others?
What's interesting is there really isn't an age group that it targets more than others. When you age, you have a higher risk. But we are seeing more and more that people are being affected by heart disease at 20, at 17, at 22, at 29. So there's not a real age bracket that you can say, oh, phew, I don't need to worry about heart disease. You need to worry about it from day one.
And for your children, then.
Exactly.
And so is that because we are getting to be more and more obese in this society?
Absolutely.
Yeah. And so there's more guilt to throw on a mother. All those boxes and bags I pull out of the freezer to feed my kids really should be healthy, fresh food.
Well, that's why we spend a lot of time on heart.org, which is our website, talking about the resources that are available for families to incorporate physical activity with their smaller kids, to figure out how to make healthy meals within 10, 20, 30 minutes, because we know everybody's running around and there's a busy day.
Any tips on that? Can you pull one out? I know you weren't probably prepared for that, but I'll tell you, that's the tough part, because nowadays most families are dual parent, full-time working families. So you rush home. I know I get home at 6:45, and who has time to cook an hour-long meal?
Right. One of my tips, and this is just a personal tip, is trying to go ahead and cook a meal on Sunday and put it together and have the leftovers there in the fridge so that when I come home from a busy day, I can just pull it out and kind of microwave it and keep moving. So, but there are also, different ways that are, available in the grocery store. Now we have frozen vegetables, so we don't have to worry about doing a lot of prep on vegetables, and we have easier ways ways that we can cook lean protein, chicken, fish, that kind of thing. So I think those are probably the best kind of ways to start the process, making sure that you are, when you're in the grocery store, picking up the nutritious things that will make up a meal. So making sure you're getting whole wheat and not refined flour, making sure that you are cutting down on sugar and salt, making sure that you actually incorporate a vegetable into every meal. Those are the things that, we tell people just to start that way. And as you move forward, it'll become easier and easier.
And even with my kids, I remember when I made the move from white rice to brown rice.
Correct.
Oh, a lot of squawking in the house.
Yeah.
And now the kids like the brown rice. It's just a matter of being consistent and adding cheese. But, you can make healthy choices and doctor it up a little bit so that they'll eat them like vegetables.
Right.
A little cheese sauce can't hurt them, but they're getting their broccoli in.
Right.
And then we'll pull the cheese sauce in later once they like the broccoli, right? Okay, well, that's good, healthy tips. Now, I hate to say this because I say it on lots of shows, but I recently lost 70 pounds.
Great.
And it was really focusing on, is it in a box? Is it in a bag? Or am I buying it fresh? And really just that mindset that I go to the produce aisle and I buy the vegetables that I like and I eat the lean protein like the chicken or getting ground turkey. And again, that was another issue in my house. I started making meatballs with ground turkey instead of ground beef. At first, they were like, these taste funny. And now they don't even notice a difference. Or chicken sausage instead of pork sausage or whatever. So just little things, and I'm sure, can you shout out your website again so that they can get some of these tips from your website?
It's heart.org.
Heart.org. Well, that's easy enough. Kimberly, I want to bring the show over to you at this point. We did talk to you before about your story. Can you recap your story a little bit? Because I want to talk a little bit more specifically.
Yes, I was born with an abnormal heart valve, and at age 42, I received a new heart valve, and I also have a pacemaker, and then I received another surgery where my pacemaker lead broke, and it had to be revised. So I've had 3 surgeries in 36 months. 1 heart valve replacement and 2 pacemaker surgeries.
And you're looking fabulous and doing fabulous and wearing your red.
I'm wearing my red. I'm a proud member of the Go Red for Women campaign.
Wonderful, wonderful. I do want to talk a little bit about your story and what happened and how it affected you and how it affected your husband and how it affected your children.
Okay.
So first let's talk about you. You had a little shortness of breath.
Yes.
You went to the doctor thinking maybe you were getting a cold.
Maybe.
Or something. You knew something wasn't right.
I knew something wasn't right.
And when the doctor told you what was happening, how did you respond to that?
I received a phone call on my voicemail, and it was the longest phone call I've ever received in my life. I froze in the kitchen. I just returned home from work, and that phone call changed my life forever. And then when we were told I have heart blockage, we didn't have time to process it. The doctors had to move quickly to implant the pacemaker. My journey has been a process through the whole 36 months. My husband has been by my side along with my church and my neighbors and family and friends. Only thing I could really touch base on, you need the emotional support, you need the spiritual support. I have embraced my purpose of helping cardiac patients because I'm living it every day. Someone said to me, "Oh, you're not a patient anymore," because they see me walking around and I'm active. I said, "No, I'm a cardiac patient for life. The pacemaker's in my body for life."
Right. That's right. And it's always in the back of your mind now.
Every day.
Yeah.
I'm living with it. So it's processing the information. I didn't have time to feel sorry for myself. I didn't have time for a pity party. I had to lean on my faith. God healed me, and now I'm just committed to helping other families, sharing with my husband. We will celebrate 19 years in June.
Good
and
for
just the
you.
whole process, he would not let me give up. I have high moments and I have low moments, and he's right by my side the whole way. So basically when I see the patients at the hospital, I really try to, it's okay to have a low moment. You don't stay there. I mean, you're human, but you really need to focus on moving forward and focus on your blessings and not your problems. And that's why I wrote my story in my health blog about how God healed me and how I'm committed to helping others.
And we're so glad he did.
Thank you.
But, things are going through my mind, too,
Yes.
that I'm sure went through your mind with that
Yes.
phone call. And what Daria said This is happening to people younger and younger and younger. And so even aside from the physical and emotional
Yes.
thoughts that are going through your head,
Yes.
we talk about preparing people, educating people so that they are ready to make the right choices for themselves.
Yes.
When I listen to your story, I think, and is my paperwork in order?
Yes.
And what if I was told tomorrow I needed to go in for heart surgery? Do I have my will? Is everything clear? Did I want to make any changes? And I know as a 40-something, me and very many of my friends don't have that in place.
Yes.
So even on a side note, to make sure that your affairs are in order, because you never know if you're going to get hit by a bus tomorrow.
Yes.
I'm sure that went through your mind knowing you were going in for heart surgery.
I went through a range of emotions on the drive to St. Joseph Hospital that morning on February 12th, 2009. And when we drove into the parking lot, I didn't want to get out the car. I didn't know what I was getting ready to face. So when we walked into the lobby, I asked for the chaplain to come down, and he prayed with us. And then I released the fear. But it was the longest drive from Gwinnett County, to be honest.
Unbelievable.
Yes.
Let's talk about your family. You mentioned
Yes.
the loving support of your
Yes.
husband of 19 years.
Yes.
Good for you.
Yes.
Talk about his journey.
It
through
has
all of
been a
this.
journey for him. He has a wonderful support system from his job, his coworkers, his manager, our neighbors, our church members, his family, his immediate family. It was very important to me to contact everyone before I went to the hospital to please make sure he's okay, give him the support, and my children as well, because things had to carry on, and he was in charge. I could not drive for 30 days. He ran errands. He made sure the kids' homework was completed, and he had to also work
Yes.
and take care of me as well. So it was a lot on his plate, but I'm proud to say that everyone stepped up and provided the support to him. He really needed it, and I'm just glad we're united together to face any health obstacles
And
together as a family.
We do that. We tend to know that somebody is sick and make a meal
Yes.
and come over and help or whatever.
Right.
Do what you can, just that one meal that he can pop in the oven that he doesn't have to make because you're too sick.
Exactly.
It's so helpful. Friends and neighbors reach out.
Yes. So that's why I made the list, the support agenda. And everyone took turns. They were on the schedule to let him know when they were coming. And it made a big difference for him.
Wait a minute. You made a list.
I made a list.
Before your surgery that
before-
you called a support agenda.
I made
Oh
a
my
list.
Lord,
I was
you
on a
sound like me.
PTA board,
Oh.
and I was on a PTA board at Morgan Hill Elementary School, and I contacted my friends, and everyone just reached out from my job to church in the neighborhood. So my family was taken care of. And,
God
it
love
was-
you. I love that. That's wonderful.
Well,
but
I
you know
ended-
what? It's important.
It
and
is
you made sure
important.
your family was taken care of.
Well, the pacemaker was an emergency, so I was told I would be in the hospital 4 days, ended up being 11.
Wow. So,
So-
folks, not everybody is going to create a support agenda before they go in to have surgery. I love that. But if you are hearing this story
Yes.
and you know of a family in need, maybe that's something you can do to help that family.
Yes.
Pull people together and come up with some kind of a rotation. Kimberly, you
Yes.
have a loving husband of 19 years. There's a lot of folks out there that don't.
Yes.
And they need their church, and they need their neighbors, and they need their community to help them.
And everyone worked together. There was a schedule laid out, and I just thank God for my support system. I want
Wonderful.
to focus on my son AJ and my daughter Mariah. We had to really sit down and explain to them what would take place. And a lot of people say, are you going to tell them? I'm like, yes, they're part of our family. They have feelings. We validate their feelings. And they're also part of the healing process. So I do want to speak to the families facing a similar situation like mine. Please communicate with the teachers, the principals, the counselors, the neighbors, and the church.
And you feel strongly to tell them the truth.
Yes, we were honest, and they're part of the healing process.
And children know more because, I work in hospice, and,
Yes.
and so I'm fortunate enough to know about children's grief and children's anticipatory grief
Yes.
and how to work with children. And there's different ends of the spectrum on this,
Yes.
but I'm in your camp.
Yes.
I believe, as hard as it is, to give them the truth on their level,
Correct.
so that they can process and feel empowered and be a part of the process. So how did that go? How do you tell a 7-year-old girl and a 10-year-old boy that you're about to go in and have heart surgery?
We explained the process to them, and also I contacted the school counselors who also provided tools at the school to walk with them the whole process about what was getting ready to take place. We asked them, did they have any questions? And they're still part of my healing process. My son is in the 7th grade now. My daughter's in the 4th grade. She educates her classmates about what happened to me, and it's just awesome. They're learning as well.
She's going to be creating a support agenda for her
friends. Yes. If she hasn't already.
Like mother, like daughter.
Because she, sometimes when I'm at the health fairs, she'll say, my mom, this is my mom, and she's a heart survivor, and we're so proud of it. I'm just overwhelmed that we have helped them also in the process, because we were honest with them.
It really sounds like you've done a great job in helping your whole family.
Yes.
But I do want to just kind of bring you back to that conversation with your daughter and your son. I want to help the people listening right now, because if I'm in your shoes, this is my biggest concern. How do I say it to them? How do I broach the subject? What do I do? How did you have that conversation?
My message to the families in the community, I would basically tell you, if this was all new to us, we didn't know where to begin, so we contacted help. We received help in how to explain the process with them. And once again, the counselors in our church family helped us just walk through them on their level.
Were they with you?
No, they were not with us. They were not with us. It was at our home. It took place. I put it off for like a day or two. I'm like, I'm not ready. But then we moved forward and basically receiving advice from them and then relaying to them. We talked on their level and we asked them for their input. How do you feel? Even when I returned home, they knew about my limitations, just educating them. They know I couldn't run up and down the stairs because we were already informed of what would happen when I come home.
Right, walking them through what to expect.
Exactly.
That's a good idea, too.
Exactly.
Now, what were some of these resources, if you could tell a family right now, this is the path they're going to be going down and they need to reach out and find out how to talk to their loved ones. Is there a resource you could share with them?
I'm a proud member of Mended Hearts as well. To locate a local Mended Hearts chapter, you would dial 188-HEART-99, or you can go to the website www.mendedhearts.org to receive additional information.
And Mended Hearts is an effort of heart disease survivors who support folks that are going through this. So you're getting first-hand information and experience.
Correct.
And they're throughout the country?
They're throughout the country. And to become a member, one of the requirements is a heart survivor, because that's part of the healing process as well. And I really enjoy sharing my journey with the heart patients.
I enjoyed you sharing your journey today. Thank you.
Thank you.
Daria, real quick, there's a event coming up in September through the American Heart Association. I want to make sure people know about it.
Sure. It's our largest fundraiser in Atlanta, and that is the Atlanta Heart Walk, September 22nd, and it's going to be at Atlantic Station.
And if they want information on how to participate, do they just go to...
They go to www.atlantaheartwalk.org.
atlantaheartwalk.org. Mm-hmm. And I'm sure that there are other walks in our Phoenix market, and you can just reach out to your local American Heart Association chapter in your community to find out how you can participate in one of these walks. Daria, is there anything you want to leave the folks with today before we go? Because again, this shows always end more quickly than I want them to. Lasting words of wisdom for our folks out there.
Just pay attention to your body and make sure that you are making the daily choices that you need to make sure that you are taking care of the most important vital organ in your body. They're not huge choices. They're small ones. Don't eat cake, eat salad. Make sure you get 20 minutes of exercise. Make sure that you are paying attention to what's going on a daily basis with your body, and making sure that as soon as you feel something that you call 911.
And take care of yourself, because your family needs you. We're good at taking care of our families and terrible at taking care of ourselves. Put yourself first so that your family can have you. Daria, real quick, there's a event coming up in September through the American Heart Association. I want to make sure people know about it.
Sure. It's our largest fundraiser in Atlanta, and that is the Atlanta Heart Walk, September 22nd, and it's going to be at Atlantic Station.
And if they want information on how to participate, do they just go to
They go to
Heart.org?
www.atlantaheartwalk.org.
AtlantaHeartWalk.org. And I'm sure that there are other walks in our Phoenix market, and you can just reach out to your local American Heart Association chapter in your community to find out how you can participate in one of these walks. All right. Well, thank you, ladies, so much for joining us
Thank you very
today.
much. Thank you.